I'm the Chief of Demographic Statistics at the UN Statistics Division of the Department of Economic and Social Affairs of the UN Secretariat, again here in New York. This is a welcome to the side event of the 53rd session of the United Nations Statistical Commission, and that will focus on the implementation of the United Nations Legal Identity Agenda. We welcome all of the participants, and by way of introducing the design of the side event as well as the program, allow me to first outline that the United Nations Legal Identity Agenda, which is a holistic approach to civil registration, vital statistics and identity management, has been launched in 2019 and then officially adopted by the United Nations Statistical Commission and the Economic and Social Council in 2020. It is based on the definition of the working definition that the United Nations adopted on legal identity, and the UN Legal Identity Agenda builds up on the existing principles and recommendations and international standards on civil registration and vital statistics. This side event goes hand in hand with the preparations for the 53rd session of the Statistical Commission that starts on Monday. There will be one agenda item focusing on the UN Legal Identity Agenda and its implementation. And so this side event is designed to contribute the information that has already been submitted to the Commission, and to provide additional information for all the participants in terms of the current developments and the current work that is done under the auspices of the UN Legal Identity Task Force, which has been established by the Deputy Secretary General of the United Nations and is co-chaired by UNDP, UNICEF, and UNSD DESA, the Statistics Division DESA. The design of this side event follows a very broad umbrella that the United Nations Legal Identity Agenda is actually covering. We will start with the presentation of the work that has been done under the UN LIA Task Force and the Global CRVS Group. And this will be delivered by Mr. Niall McCann, who is the Policy Advisor and Project Manager of Legal Identity Agenda of UNDP, at the same time a chair of the Global CRVS Group and the member of the Secretariat of the UN Legal Identity Task Force. Then we will turn our attention to the implementation of the UN LIA at the national level. In the previous 2 years, together with our colleague from United Nations Economic Commission for Africa, we have developed a set of assessments in pilot countries in Africa, and we started supporting the implementation of the UN LIA in those countries, both in terms of providing technical advice and also providing some funds for jump-starting certain activities under the overall model as recommended by the United Nations. So we will have presentations from 2 countries in Africa, the first from Côte d'Ivoire by Monsieur Fidel Yapi, who is the Director General of Administration and Local Development in the Ministry of Interior of Ivory Coast, and followed by Ms. Janet Musheru, who is the Registrar General, the Secretary of the Department of Civil Registration Services of Kenya. So we will have Kenya and Côte d'Ivoire presenting the implementation under the overall chapeau of the United Nations Legal Identity Agenda. To essentially also showcase that the agenda itself goes well beyond just the civil registration and vital statistics, and also goes into the essence of understanding the phenomena such as the pandemic. We will then ask Mr. Kevin Mccormack, who is the chair of the UN DESA WHO Technical Advisory Group on COVID-19 mortality, and at the same time head of the division in the statistics of the Republic of Ireland, to present the work that is being done by the DESA and WHO Technical Advisory Group in order to assess the impact of COVID-19 on primarily the functioning of civil registration and the appropriate measures to try to essentially ameliorate the gaps that have been documented over this pandemic. To then showcase how wide the UNLIA and all of this momentum is actually having at this point of time, we will then turn our attention to the overview of regional progress and outcomes of the second Ministerial Conference on CRVS in Asia and the Pacific. There is a decade of putting everything in the picture, which means universal registration of vital events. And that decade has been anchored around the ministerial conferences. The last one took place in October, and we will have an overview of the conferences, followed by the presentations from ESCAP, Ms. Petra Nachmias or Ms. Tanya Sorensen will present. Then we will have the Philippines, Mr. Melvin Suarez, who is the State Counsel of the Department of Justice, presenting on the multicultural collaboration in the Philippines. And then we will have from Georgia, Ms. Shorena Tsiklauri, who is the head of Department of Population Census and Demographic Statistics Department, National Statistical Office of Georgia, presenting on resilient CRVS systems. And then yet again, to extend the reach of the UN legal identity agenda to across the borders, we have this opportunity today to actually launch by our colleagues from the International Organization of Migration, IOM, the institutional strategy on legal identity that has just been developed for that purpose. So this is the plan for this morning in New York, of course. And then we certainly appreciate very much all of our colleagues that are in very different time zones and that are following this meeting. Now, I would like to ask Niall to please take the floor and guide us through the report on what UNLIA Task Force and the Global CRVS Group did. Niall, please go ahead. You have the floor.
Thanks a lot, Serjan. Good afternoon from Brussels. In Belgium, I have around about 8 or 9 minutes. I don't have a presentation, but as Serjan said, I'll just bring you through some of the activities of both the UN Legal Identity Agenda Task Force and indeed the Global CRVS Group in this short couple of years. Since 2018, as many of you have known, the United Nations has come together as one across the organization, both at the Secretariat level in New York, but also with all of the agencies, funds and programs active in the area of population registration and legal identity to try and bring the system together and develop common approaches in the policy arena, in the research arena, the advocacy arena, the standards arena. As Serjan mentioned, the agenda itself was developed by the task force and then was approved by both the Statistical Commission in March 2020 and then later by ECOSOC in June 2020, meaning that a holistic approach to all legal identity, that is all civil registration, production of vital statistics and management of people's identities via national population registers, etc., is now the official position of the UN. And one of the main factors in that is that we strongly advise member states that to maximize, provide universal registration of both births and deaths, and where they also operate various forms of identity management schemes, such as national population registers, national identity card schemes, or indeed, in recent years, more fully digital ID schemes, that these schemes should be linked to core birth and death registration to provide a holistic approach to legal identity from birth to death. Implementing the agenda has required a number of pieces of knowledge production that include some of the pieces of work we've been working on over the last couple of years. These include, for example, development of a methodology that would allow UN member states to literally calculate the financial cost to them when people do not have legal identity. As you can imagine, if people are unable to prove who they are, that often not only does that hugely impact on their ability to exercise their rights, but then it tends to drive them towards the grey economy, operating in the cash economy. That results in a loss of income tax, a loss of social insurance contributions, etc., for member states. So we do think that trying to develop a methodology that allows member states calculate the cost lost to them by not having people registered is a hugely worthwhile exercise, and that development, that methodology development, is nearing completion at this stage also. We have produced some guidance and a compendium on all of the UN policy across all of the member state organs of the UN, and indeed across all of the agencies, funds and programs of the UN, in terms of policy on data protection and privacy, which of course, particularly with the increased digitization of civil registration and identity management schemes, is of huge importance, and putting all of those pieces of standards, policies, resolutions, etc., from the General Assembly, from the Human Rights Council, as well as all the individual policies of the agencies, putting them all into one place was something that we completed, and that's available for anybody, and indeed has been published on the Legal Identity Agenda website. We are also working with our colleagues, led by our colleagues in the World Food Programme, on developing a set of basic principles around the use of biometric technology in general, in public administration in general, but in population registration and legal identity in particular. As you can imagine, for example, there are some very, very complex issues with regards to using biometric technology to identify people. That includes, or to authenticate their identity. That includes with regards to use of biometric technology with children, use of very invasive technologies such as facial recognition systems as part of a main biometric to register people, and what are the knock-on consequences then in terms of potential surveillance or abuse of human rights in the future. So that piece of work is also nearing completion and will be published in the following couple of months. At the country level, we have managed to roll out seed projects in a number of countries, including largely focused in Africa, in countries such as Mozambique, in DR Congo, in Liberia, Kenya, Sierra Leone, etc. And we've also, of course, as individual UN agencies, also been implementing support to member states' civil registration and national ID initiatives at individual agency level in countries such as Cameroon, in Kenya, in Zambia, and indeed further afield in countries, in UNDP's case, for example, in countries such as Honduras and in Vanuatu. That's a little flavor of some of the work that's ongoing in the UN Legal Identity Agenda Task Force. At the moment, we'll be happy to provide any more information further to that. There's also the work of the Global CRVS Group. This is a group that includes both individual UN agencies such as UNDP, UNICEF, UNHCR, UNFPA, etc., but also includes other major international governmental organizations such as the Organization for Security and Cooperation in Europe, the Organization of American States, the Pacific Community, etc. And that is a convening forum. It also includes, by the way, non-governmental organizations, but who have extensive expertise in matters related to CRVS, such as the Center for Disease Control, etc. And that is a convening forum that allows all of the international players active in the field of CRVS to get together on 3 times or 4 times a year to update each other on our work, figure out ways that we can collaborate together. For example, one of the things in this year's action plan is the plan to try to develop a core set of indicators that could be monitored across the world at all times, that would allow anybody, researchers, academics, but also UN member states, other agencies, etc., go to that list of indicators and see which countries are reporting, what are the various level of rates that they are reporting for things like universal coverage of birth registration, death registration, etc. Because bizarrely at the moment, we felt that there was actually no one resource that anybody, researchers, academics, policymakers could go to try and see the overall state of civil registration and the production of vital statistics across the world. And then indeed in 1 or 2 of the other agencies, for example, our colleagues in Vital Strategies that are a member of the Global CRVS Group have rolled out their Counting Everybody campaign to enhance and expand the implementation of CRVS all around the world. And so they are able to update the Global CRVS Group on the state of these types of initiatives. So this is an excellent forum, we believe, and one that will continue its work over the next couple of years. Sergeant, I think that's probably it from me at this point. Happy to take questions afterwards. Thanks.
Thank you very much. Thank you very much. Certainly, I do believe that there will be requests for further elaboration and information, and then we will see how we are going to handle it. Definitely, we will reply to every single query that we are going to receive. Let us now turn our attention to the national examples of implementing the UN-LEA. We will start by Côte d'Ivoire, Ivory Coast. So Mr. Fidel Yapi, who is the Director General of Administration Local Development, Ministry of Interior. Vous avez la parole, Monsieur Yapi.
Merci. Je voudrais juste... La vidéo ne fonctionne pas. Vous m'entendez?
Oui, on vous entend très bien.
Je voudrais juste vous présenter, malheureusement, c'est une langue française que je vais utiliser. Très rapidement, vous présenter un peu ce qui se fait en matière d'enregistrement des enfants en Côte d'Ivoire. Donc, la première diapo que vous avez, je ne sais pas si vous avez les diapositives. Il faut juste savoir qu'actuellement, la population ivoirienne, c'est 26 millions d'habitants.
Est-ce que vous avez, monsieur...
Oui.
Monsieur Yapi, donc, est-ce que vous avez votre présentation sur votre écran ou sous... Ah, là, voilà, maintenant.
Vous l'avez?
Oui, maintenant, nous l'avons. Vous êtes au dispositif lequel, le numéro 2?
Non, le numéro 2, tout à fait. Donc, c'était pour présenter le contexte global sur l'enregistrement des naissances en Côte d'Ivoire, c'est-à-dire la population, les nouveau-nés, autour de 870 000 habitants, nouveau-nés. Dans le cadre institutionnel, nous avons bénéficié de l'expérience du CRVS qui nous a permis de faire la réforme institutionnelle et législative de l'état civil, qui ont conduit à adopter 2 textes, notamment la loi sur l'état civil et la loi spéciale pour ceux qui n'ont pas d'acte de naissance dans les délais. Donc, pour vous présenter un peu la situation, il y a environ 1694 centres d'état civil. Les taux d'enregistrement pour les enfants de moins de 1 an, à partir des données que nous collectons chaque année, c'est autour de 65%. Et avec l'enquête des vies des ménages qui a été réalisée en 2016 pour les enfants de moins de 5 ans, on tourne autour de 72%. En matière de santé, il faut savoir que le taux d'accouchement assisté en Côte d'Ivoire, c'est de 75% pour des taux d'enfants vaccinés pour le BCG, c'est-à-dire à la naissance autour de 86%. D'où la nécessité de coupler les services de déclaration de naissance avec les services de santé.
Monsieur Yapi, si
oui.
vous donnez une seconde, juste pour traduire ça en anglais.
D'accord, OK.
Well, so this is the first slide of the presentation. These are the essential figures. The population of the country is over 26 million. You'll see here the number of new births is over 170,000. It also presents a number of legislative activities that took place in the past 5 to 6 years. This is the number of the health institutions, which is over 2.4 thousand, and the Center for Civil Registration are numbered to 675. Asking if we look at the rates of registration, you see 65% under 1 year of age and 72% under 5 years of age. Si vous voulez continuer, Monsieur Yapi, s'il vous plaît.
Donc, pour la mise en place d'un système entre l'état civil et la santé en Côte d'Ivoire, comme je vous l'ai dit, à partir du CRVS et avec l'appui des partenaires techniques, notamment l'UNICEF, on a mis en place un cadre de concertation entre le ministère de l'Intérieur qui est chargé de l'état civil, le ministère de la Santé pour ces questions de santé et le ministère de la Justice qui contrôle l'état civil. Donc, ces trois acteurs se mettent ensemble pour pouvoir booster à travers la structure de santé l'enregistrement des naissances. Donc là, vous avez de 2018 à 2021 les taux de couverture de l'opération que nous avons initié depuis 2018. 2018, date à laquelle les nouvelles réformes ont été mises en place. Et 2021, tout le pays a été couvert au niveau des nouveaux mécanismes d'enregistrement de naissance. C'est-à-dire que les gens, dès la naissance, on leur établit des actes, des attestations de déclaration ou des certificats de naissance pour pouvoir permettre de faire la vaccination, l'enregistrement de naissance. Vous pouvez traduire?
Oui, oui, bien sûr. This is an overview of the interoperability that has been put in place in Côte d'Ivoire, starting in 2018. That involves the Ministry of the Interior, the Minister of Health, and the Minister of Justice, in order to establish the services for the population, and primarily in terms of the coverage of the newborns. We can see here the results from 2018 to 2021. So essentially, the point here is that they were able to establish an understanding between these three major institutions in order to make sure that the registration of births is elevated at 100%. Continuez, s'il vous plaît, Monsieur Yapi. Monsieur Yapi, on ne vous entend pas.
Donc, je disais, vous m'entendez?
Oui, maintenant oui.
Je disais que je vais vous présenter 4 diapos qui vont montrer un peu l'évolution des taux d'enregistrement que nous avons eus lors de la mise en place des nouveaux mécanismes, c'est-à-dire à partir de 2018. Avant 2018, il n'y avait pas les nouveaux mécanismes. Donc, les diagrammes, ce qui est en vert, c'est les naissances de 0 à 3 mois. Et en même temps, nous avons calculé le taux de déclaration dans les délais en tenant compte des projections de naissance. Donc, avant 2018, vous voyez que le taux descendait, mais à partir de 2018, avec la mise en place de l'interopérabilité entre le système de santé, le système de vaccination et l'état civil, nous avons des taux qui ont commencé à croître pour atteindre en 2020 autour de 61% dans les délais, c'est-à-dire de 0 à 3 mois. Vous pouvez traduire?
So this is the graph illustrates the functioning of this interoperability between the three institutions, and one can see that until 2018, when this interoperability has been established, the rate of the registration of births was going down, and since 2018 it is clearly going up, and then this is the direct result of the system that has been put in place. Continuez, Monsieur Yapi, s'il vous plaît.
Donc, pour l'enregistrement pour les enfants de moins de 1 an, la même dynamique se retrouve à partir de 2018, où vous avez des taux qui continuent de croître. Parce que la législation, dans les délais, c'est 0 à 3 mois. Donc, il y a des enregistrements tardifs pour des raisons diverses. Donc, nous allons sur l'année. Et nous voyons qu'effectivement, lorsque nous prenons pour les enfants de moins de 1 an, à partir de 2018, vous voyez que la courbe croît et là, nous sommes autour de 65% d'enregistrement. Vous pouvez y aller?
So what we see here is actually the results of the introduction of the law, because here we are seeing the rate of registration of the newborn up to 1 year of age, and we can see that from 2018 it obviously goes considerably up, and this is actually the result of having the law understanding and delayed registration and asking for the delayed registration to be taken into account in the all numbers. Continuez, s'il vous plaît.
Et, les deux diagrammes également montrent, lorsque nous faisons les statistiques entre les données de naissance dans les centres d'état civil par rapport aux données d'enregistrement de naissance dans les centres d'état civil de 2018 à 2020, nous voyons que l'écart entre les naissances enregistrées dans les services de santé et les naissances déclarées à l'état civil continue de diminuer, puisque la courbe est ascendante en termes de proportion. Donc, c'est pour montrer la nécessité de travailler avec les centres de santé pour réduire cet écart. L'idéal, c'est d'atteindre 100%. Si nous avons atteint 100%, ça veut dire que tous les enfants qui naissent à l'état civil, au centre de santé, sont immédiatement déclarés à l'état civil.
This is another illustration of the progress that has been made in essentially linking the health institutions with the civil registration system. And you can see here that the ratio of the births that have been registered in health institutions, which is 82%, is now replicated in the civil registration system. However, of course, the overall goal is to achieve 100% that each birth that occurs in health institution is registered by the civil registration system. Continuez, s'il vous plaît.
Et la dernière diapositive que je vais vous montrer, c'est on a essayé de comparer entre la Côte d'Ivoire et le Ghana, qui est un pays voisin, l'impact de la pandémie de Covid sur l'enregistrement de naissance. Et si vous regardez toujours à partir de 2018, 2019, on constate que pendant que la courbe en bleu qui représente le taux d'enregistrement du Ghana a accru jusqu'à 80% en 2019, au niveau de la Côte d'Ivoire, à partir de 2018 où nous avons implémenté les nouveaux mécanismes, vous voyez que la courbe est toujours ascendante, ce qui montre qu'avec l'implémentation des nouveaux mécanismes d'enregistrement en couplant la santé et l'état civil, on a eu un faible impact de la COVID au niveau de l'enregistrement des naissances.
This graph now illustrates the comparison between Ghana, which is a neighboring country, and the Côte d'Ivoire. And what the major point here is that, as you can see, this is the rate of registration of births in Ghana, and this one here is in Côte d'Ivoire. So one can see that in Ghana it was going very high until 2019, but then the progress in Côte d'Ivoire has been steadier. Now here we have this big decrease. This is due to the pandemic, obviously, because of the not functioning of civil registration system. But then Côte d'Ivoire was able, because of these new mechanisms, to keep the rate going up. Merci. Continuez, s'il vous plaît.
Donc, en termes de perspective, à partir de ce diagramme qui montre que l'implication état civil, système de santé, nous avons voulu maintenant dans les jours, dans les semaines à venir, mettre en place un logiciel d'interopérabilité entre les maternités, les services de vaccination et les centres d'état civil, de sorte que lorsque l'enfant est né directement à la maternité, on puisse capter à partir du centre d'état civil, ou lorsque l'enfant est né hors de la maternité, puisqu'il y a toujours des naissances hors centre d'état civil, les services de vaccination rentrent en ligne de compte puisque l'enfant, dès le premier bas âge, doit recevoir 3 doses de vaccin, notamment le BCG. Donc, nous avons développé un outil d'interopérabilité entre les 3 structures. Les projets pilotes ont déjà démarré depuis février 2020 et nous comptons généraliser à l'ensemble des maternités d'ici octobre 22, mais je pense que ça sera fait jusqu'en juin 2022. Et ces données seront intégrées dans le système de santé, qui est le logiciel DHIS2, pour que immédiatement, lorsque l'enfant naît, on l'enregistre à l'état civil et que les parents, sans se déplacer, puissent avoir le numéro d'enregistrement.
So this is putting the things in perspective, and this is something that is now being put in place in Côte d'Ivoire. We are talking about the equipping the health institutions and the civil registration offices with the computers, so that the registration of births in the health institution is immediately and automatically reflected in the civil registration system, so that the parents can take the birth certificates with them, or the death certificate, as the case may be, and also to make sure that there is a proper count of children in need of vaccination, primarily the BCG. À vous, monsieur.
Donc, pour terminer, je voudrais vraiment dire au nom du ministère de l'Intérieur et de la Sécurité tous nos encouragements et nos remerciements à tous les partenaires qui s'impliquent à l'enregistrement de naissance pour ne pas avoir des apatrides en Côte d'Ivoire, et notamment saluer le gros effort que l'UNICEF fait en faveur des enfants ivoiriens. Vous voyez par exemple le certificat de nationalité, le certificat médical de naissance. Une fois que l'enfant naît, il a déjà un document pour certifier de son existence juridique. C'est à partir de ce certificat que l'acte de naissance est établi par le centre d'état civil à l'enfant. Voilà un peu ce que je voulais dire, et remercier tous les partenaires qui pourront nous accompagner également dans ce processus. Merci beaucoup.
Merci, merci, Monsieur Yapi. Well, so this is the concluding slide. Mr. Yapi expressed the appreciation of all the institutions in Côte d'Ivoire, to the partners that that supported this transition towards interoperability between the health systems and the civil registration systems, primarily UNICEF and the UN Legal Identity Task Force that provided this support. And he is showing here a newborn with the certificate of birth that also is a certificate of nationality, the Côte d'Ivoire. Merci beaucoup, Monsieur Yapi. Thank you, Mr. Yapi. And then we are now moving to the second example of the implementation of the UN Legal Identity Agenda in Africa. This would be delivered by Ms. Janet Musheru from Kenya, and she is the Registrar General, the Secretary of the Department and Department of Civil Registration Services. Ms. Musheru, please take the floor.
Good afternoon, everyone. I'm going to share my screen. My name is Janet Musheru, Civil Registrar in charge of civil registration in Kenya. The outline of my presentation is an introduction. I'll talk about the legal framework, and I'll mention the status of birth registration in Kenya. I'll also talk about the status of death registration in Kenya. And I'll mention the implementation of UNRIA in the country, and the milestones we have achieved with support from UNRIA. Then I'll talk about CRVS integration and interoperability, and the linkages of UNRIA with other ongoing strategies. And then I'll talk about the legal identity during emergencies, the lessons we have learned during COVID. I'll start with an introduction. Civil Registration Services is a government agency mandated to register all births and deaths occurring in Kenya and those of Kenyans occurring abroad. Registration of births and deaths is carried out in Kenya on agency basis. So there are those births and deaths that occur in the community. They are registered by the assistant chiefs. And those occur in health facilities are registered by health personnel. Registration of births and deaths is largely manual and is compulsory. The legal framework, we operate under the Constitution 2010, which provides for universality and registration of births and deaths. Births and Deaths Registration Act, Cap 149, Rules of Kenya, providing for universal registration of all births and deaths within the stipulated time in Kenya. Other statutes, such as data protection Huduma Bill 2021, and the National Civil Registration and Identity Management Policy 2021, which looks forward to establish a digital national population database to be a single source of foundational and functional data. Status of birth registration in Kenya, you can see the figures there. In 2016, we were at 64.1%. 2017, the figures dropped to 60.9%. 2018, we were at 73.4%. 2019, we went to 76.2%. 2020, we are at 82.9%. You can see the graph there. We are not doing badly apart from 2017 when the birth registration went down. And you can see that the proportion of birth registered in health facilities has increased from 95.6% in 2019 to 97.7% in 2020. There is a general decline on birth registration from the community from 4.1% in 2019 to 2.3% in 2020, 82.3% in 2020. I think why there is registration of birth is declining in the community is because of the interventions by the government, which is increasing the universal health care. So that is having a positive effect on registration because more children are born in health facilities. Status of death registration, you can see in 2016, coverage was 41.9%, and in 2017 it was 0.1.2%, 2018 was 40.5%, 2019 it declined to 39.1%, and 2020 now it's at 37. It is at 2020 it was at 37%. Nationally, death registration has been on a downward trend from 41.9 in 2016 to 37% in 2020. The proportion of deaths registered in health facilities has declined from 57.2% in 2019 to 53.6% in 2020. There is an increase in death registration in the community from 42.8% in 2019 to 46.4% in 2020. I don't know whether we can attribute that to COVID-19, but we'll see. The implementation of UN Legal Identity Agenda in Kenya. In October 2019, Kenya confirmed willingness to pilot the operationalization of SDG targets 16.9 and 17.19b. UN REA rapid assessment was undertaken in December 2019. Then the government established.
Ms. Mucheru, can you just give me a second? Mr. Haq, can you mute yourself and perhaps turn your camera off, Mr. Haq? Thank you. Please continue, Ms. Mucheru. Sorry about that.
Yes. Yeah, okay. There was an establishment of UN Government of Kenya Technical Task Team on implementation of the National Integrated Identity Management System, founded on Crvs, where all senior government officials were involved in key ministries. And we also strengthened the collaboration and coordination of government ministries, agencies, and departments in legal identity management. So there was a lot of coordination, collaboration, and strengthening of government agencies dealing with identity management. The milestones so far achieved from UN REA, with support from UN REA, automation of the Crvs system. That this one we've prepared to automate all our systems so that birth and death registration can be done on a digital platform. We started by digitizing 46 million historical manual records. They were digitized. Then we redesigned Crvs system in readiness for full automation to enable integration with all relevant systems within the legal identity ecosystem. CRS has benefited from UNRIA with ICT equipment through UNDP support from the government of Japan, and this we have distributed to all our county offices so that they are in readiness for full automation of our services. This will help in rolling out the CRVS automated system to sub-county civil registration offices. We have also started building capacity to all our officers. Then we did revision, we revised the birth and death registration forms. We did review the business process. We also reviewed the tools, the forms, and then we came up with standard operating procedure so that everybody operates on the same standard. Then we did a review of the legal framework. The Data Protection Act was passed. Huduma Bill first reading has been done in Parliament in 2021. We have also come up with the regulation to operationalize the bill. And currently the bill is undergoing public participation as is required by the Constitution. And also we've also undertaken a high-level advocacy and engagement with senior government officials so that all of us are speaking from the same page and they all understand the importance of CRVS. We also undertook a CAP study on birth and death registration, and the report is available. We also did demand creation through development of communication materials, which we are sharing with the media houses so that they can be our agents of creating awareness. We are also strengthening and coordination of stakeholders on their roles and responsibilities in implementation of holistic civil registration, vital statistics, and identity management system. So we want everybody to understand the importance of civil registration so that even in the hard to reach areas and marginalized areas, everybody understand the importance and so that our coverage can improve. Then civil CRVS integration and interoperability. We also realize the importance of all systems talking and integrated and talking to each other. The proposed Huduma Bill 2021 establishes the National Integrated Identity Management System with the objective of establishing a national population database as a single source of data for all individuals. CRVS automated business process has developed an end-to-end system encompassing all CRS functions linked to NIMS. It will enable issuance of unique identifier assigned at birth and exited at death through death registration. We are currently engaging with the various key government ministries, agencies, and departments, and even the private sector to integrate with the NIMS and to work out modalities of doing that. So as you can see, that is how the various agencies and departments will interoperate. So you can see civil registration, an applicant comes, and then their documents are checked. Then they by the registration assistant. Then that record is registered by the sub-county registrar. And then CRVS database, that is birth and death registration is updated. Then from that, it will go to the national database where the other departments can get the information they require so that they are able to check their systems. They take the data that is required, and those are departments like National Registration Bureau that issue IDs. We also have refugee surveyors. We are also working very closely with immigration. We are also working with NHIF, NSSF, and others. So we are working towards integration of all those registration agencies so that they are able to share data as they require. Then linkage of UN legal identity agenda with other ongoing strategies. The other strategies which are ongoing, like the rollout of the maternal and child health strategy to register unregistered community births during immunization. This in areas where we have applied this, it's done very well because we are able to capture those children who are not registered at birth. Then we have also undertaken the midterm review of the strategic plan, because the strategic plan we are operating under is ending next year. So we undertook the midterm review and we are preparing for a new one starting next year. We are also expanding CRS offices from 108 in 2018 to 27 in 2021. Actually, now they are not 127, they are 129. And we are still trying to increase so that we can take services near to the people, because we realize there are people, we don't want our people to be traveling very long distances. We want to take this service closer to them. But in the meantime, before we do that, we are trying to undertake mobile registrations in areas which are hard to reach and in areas where we have pastoralist communities so that they are not left behind in registration. We are also undertaking national stakeholder engagement, where we are engaging all our stakeholders, telling them what we are doing, because we need each one of them to support us in what we are doing so that we are able to achieve our goal of having everyone not left behind. Then we have also, you have seen from my presentation that death registration in 2020 was only 37%. So we started implementing rapid mortality surveillance so that we can improve the death registration. And this we are doing with the support of WHO, CDC, vital strategies, and we are doing, we are continuing, and we are very good preliminary results. We are seeing very good preliminary results. We are also benchmarking with other countries on the best practice and technology in registration. We are also undertaking awareness and advocacy creation on civil registration services and vital statistics, targeting all areas and especially arid and semi-arid areas. We do production of Kenya Vital Statistics report. We undertake analysis, report writing and printing, and dissemination. We are strengthening the dissemination and data so that we come up with quality data that can be disseminated, and we are also trying to create a demand for that data. We also undertake monitoring and evaluation of CRS, registries and registration assistance across the country to see where they are going wrong and to identify areas of improvement. And this we are doing with our partners, that is UNDP, UNICEF, and others. Legal identity during emergencies, that is COVID-19. The lessons we learned that legal identity remains of crucial importance during public health emergencies and pandemics. And in Kenya, it was made an essential service. We did not cross, we just came up with strategies to make us continue working. In fact, some people are working at night and others during the day so that we continue registering. And that is why our birth registration wasn't affected much. A complete civil registration system is an ideal component in a population for proper and accurate data reporting. Emergencies and disasters have potential long-term impact on the development and performance of CRVS systems. Hence, the need to put in place a resilient system. That is why we are doing what we are doing, so that we are able to integrate with other systems and we can have a resilient system that can withstand or can continue operating even during emergencies and pandemic. During the COVID-19 pandemic, civil registration service were regarded as an essential service, enabling continuous registration of births and deaths. And we are saying in Kenya, we are working towards a legal identity from cradle to grave. Thank you very much.
Thank you very much. Thank you, Ms. Mucheru, and congratulations to both you and Côte d'Ivoire for the progress that is being made in a short period of time, and the interoperability that is now being recognized as a key to the implementation, to the full implementation of UN Legal Identity Agenda and Universal Registration of Births and Deaths. Let us now turn our attention to what happened during the COVID-19 pandemic. And here I am giving the floor to Mr. Kevin Mccormack, who is chair of the UNSC WHO Technical Advisory Group on COVID-19 mortality and also head of the division in Statistics Ireland. Kevin, please go ahead.
Thank you, Surgeon. Good morning, good afternoon, and good evening to everybody from Ireland. I'm just going to, can you see my presentation, yes, Surgeon? Or can I get control?
I don't see it.
See if I can do this. Has that come up yet?
Not yet.
Okay, then I just need control. If somebody can give me control.
Frederick, can we give control?
Can I have control?
Yes, just a second. Can you try it now? You should have control. And if it doesn't work, I can share from my side. No problem.
Okay, good. Okay, so I'll just see. So can you see that? Can you see my presentation there?
No, we cannot.
I don't see the control button, has not showed up on my ribbon. So maybe we'll take it from your side. Can we take it from your side?
Yeah, sure. Do you let me know when it appears?
Yeah, I can see it there now. So if you want to bring that up to full screen. Thank you. Good morning, good afternoon, and good evening to everybody. I said my name is Kevin Mccormack. I work in CSO, Central Statistics Office in Ireland. And today I'd like to introduce some information around our UNSC WHO Technical Advisory Group on COVID-19 mortality assessment. I'll touch briefly on the composition, the reference, and the target outcomes of this group, and then touch lightly on some of the work streams, and then give some little bit more detail in terms of one of the work streams, which is working group 3 on debt registration and reporting systems. Can I have the next slide, please? Okay. So the composition of the tag shall have up to 40 members who shall serve in their personal capacities to represent the broad range of disciplines relevant to the measurement of excess mortality. In the selection of the tag members, consideration shall be given to attaining an adequate distribution of technical expertise, geographical representation, and gender balance. Members of the tag, including the chairpersons, which includes myself, were selected jointly by the WHO and UNSC and appointed by WHO under the WHO regulations for study and scientific groups, collaborating institutions, and other mechanisms of collaboration in consultation and coordination with our colleagues in UNSC following an open call for experts. There's a link here in my presentation about the membership. Can I have the next slide, please? Okay, so look at the terms of reference is to critically appraise current approaches to measuring excess mortality attributable to COVID-19, which is defined as deaths directly attributable to COVID-19, as well as those due to the indirect impacts of the pandemic on mortality from other causes of death. Develop a comprehensive, pragmatic, and policy-relevant set of measurement methods to track excess deaths due to COVID-19 in countries, including the certification of COVID-19 deaths, all in the context of the implementation of the UN Legal Identity Agenda, a holistic approach to civil registration, vital statistics, and identity management. And then finally, review and offer guidance on methods for estimating the global death toll from COVID-19. Can I have the next slide, please? So some target outcomes inform the estimation of total mortality for 2020 and 2021 in future editions of the World Population Prospectus and the World Health Statistics through reliable and policy relevant estimates of excess deaths at the national, regional, and global levels, better understanding of the direct and indirect impacts of COVID-19 on total mortality, including effects on the cause of death structure in populations and the implications for public health policymaking of the interaction of COVID-19 infection with major causes of morbidity and mortality. Improved coordination in the production of mortality and cause of death statistics within and across national and international statistical systems, consistent with the increased emphasis on strengthening civil registration and vital statistics systems promoted by both the WHO, UNSC, and partners. Next slide, please. So touching on the work streams, so the technical tag established 5 working groups to ensure that it took a comprehensive and multidimensional approach to delivering on its responsibilities. So the first working group was focused on global mortality estimates. The second working group is focused on the use of household surveys and population censuses to fill data gaps. The third working group, which is the one I'll give a little more detail in my next slides, is debt registration and reporting systems, the lessons learned from the pandemic. Working group 4, summary metrics of the toll in lives lost. And finally, working group 5, inequality in COVID-19 mortality between and within countries. Can I have the next slide, please? So looking at working group 3. So working group 3 on debt registration and reporting systems, lessons learned from the pandemic, focuses on the registration of debts during the COVID-19 pandemic. Specifically, in several countries and areas, the pandemic has had an adverse impact on the functioning of the civil registration system with respect to the registration of debts and issuance of debt certificates, owing possibly to pre-existing deficiencies in registration systems or to the breakdown of such systems during the pandemic. Those deficiencies have resulted in data gaps that constrain the timely and reliable assessment of the number of deaths and the level and patterns of mortality. Simultaneously, national health systems facing a once-in-a-century pandemic and stretched to their limits have had difficulties in maintaining regular functions, such as the reporting of deaths and causes of deaths to the civil registration system, which ultimately resulted in discrepancies among sources concerning the number of deaths caused by COVID-19. Can I have the next slide, please? Okay, I think this is the same one again. I think that's just the same one again. Can we go to the next slide? Yeah, considerations. In discussing the relevant national experience, the working group highlighted several points that should be taken into consideration by national authorities. The first one is maintained timeliness. The more time that elapses between the occurrence of vital events, especially unregistered deaths, the more difficult it becomes to fill the gaps and rectify the non-registration. The next one is number 2 is to introduce interim solutions. Several experiences involving the collection and compilation of data directly from cemeteries and funeral homes during the pandemic yielded valuable information. This also, we have followed this approach in Ireland. Reiterate the need to fully implement the United Nations Legal Identity Agenda as the fully developed model of interoperability of various components. Number 4, define and maintain standards in times of pandemic and simplify the registration processes. Number 5, learn from national experiences. Countries adapted to their circumstances and the practices used provided valuable documentation that should be followed up and sensitized. Finally, is digitize the civil registration system, enabling online registration of vital events proved to be effective in a time of pandemic. And that's my presentation finished. So thank you. I hand back to you, Surgeon. Thank you.
Thank you very much, Kevin. Thank you for this presentation. I would also like to just point out that because this is a side event to the session of the Statistical Commission, there are documents for the session itself, and those documents include some of the presentations that we have heard here, as well as in the case of Africa, for example, a condensed report on the assessment in the pilot countries in Africa, as well as some of the issues that were presented by Kevin here. Let us turn now our attention to Asia and the Pacific. As I mentioned, there is a decade-long initiative in Asia and the Pacific to put everyone in the picture, to ensure universal registration of vital events. And the second ministerial conference on the topic took place in October in Bangkok. So Petra or Tanya, who is going to present? I'm not sure.
It will be me. Thanks, Surgeon. Sorry for the
Petra,
confusion.
please go ahead. Yeah, no, perfectly fine. Please go ahead.
Surgeon, can you just confirm if you can see my screen, please?
Yes, we can see it. You can run the presentation now in full screen.
Okay, great. Thank you very much for this. Oh, sorry, it's the wrong. Sorry, I'm going to have to stop. Sorry, I put on the wrong presentation. 1 second. Apologies. too many PowerPoints. Okay, this is the right one. Okay, so thank you again. Thank you for this opportunity to present on the outcomes of the recent second Ministerial Conference on Civil Registration and Vital Statistics, and a look at the progress that we've been making in the region as part of the Asia-Pacific CRVS decade. So, you know, as I mentioned, the Asia-Pacific CRVS decade, which has run from 2015 to 2024, it's been part of the it was promulgated in from the 2014 Ministerial Conference on CRVS in Asia and the Pacific. And the ministers came together and they promulgated this vision that by 2024, all people in Asia and the Pacific will benefit from universal and responsive CRVS systems that facilitate the realization of their rights and support good governance, health, and development. And we've been working towards achieving this agreed vision. As part of that vision, in order to be able to monitor progress, a regional action framework was developed. As part of that framework, a number of goals and targets were agreed upon. These goals relate to registration of universal registration of birth, deaths, and other vital events, the provision of documentation when registration happens in order to ensure proof of legal identity, and also around the production of vital statistics. So this regional action framework, as I mentioned, there are 3 goals, and 15 national targets were set around these goals in order to enable us to monitor progress towards meeting the goals. In addition to the quantitatively measured goals, 8 implementation steps were identified. These are necessary steps that countries need to take in order to achieve universal and responsive CRVS systems. And these were reported against qualitatively. As you can see here, this is the timeline of the CRVS decade. We began, as mentioned, in 2014 with the Ministerial Conference. Then, after the Regional Action Framework was agreed upon, baseline measurements were taken and national targets were agreed upon. More recently, at the midpoint of the decade, we conducted a midterm review of progress, and we will look at some of the results of that review shortly. And again, as mentioned, we most recently had the second Ministerial Conference in 2021, and we're now entering the second half of the decade. So this is really a chance to look to see what do we need to do to really achieve the goals which were agreed upon. So you see here the reporting on the implementation steps. This is the number of countries who've reported that they have implemented one of these steps. What really leapt out at us when we saw this this review was how much work is needed really for the inequality assessment. Very few countries have implemented or completed, and very few actually have plans to complete as well. In this slide, you see an example of birth registration completeness. This is in some of the sub-regions, and progress towards meeting the goal of 100% birth registration. And then here you see the number of children who are unregistered under 5 by sub-region. So while there has been excellent progress towards birth registration, universal birth registration, there is still a very large number of children who have not been registered. with the largest number focused in South and Southwest Asia. While birth registration has been progress has been good, death registration has lagged behind. The focus has been, I think, more on births, and death registration has not kept pace with the progress in birth registration, and it also was starting from a lower point. So we've seen that really to achieve the goal of universal death registration, we're really going to have to accelerate progress in a lot of countries in the region. So moving on to the recent conference, the second ministerial conference on CRVS. Unfortunately, we did have to hold the conference fully virtual. But the positive of that was, as you can see, we did have a very large number of participants, including at very high levels. And the participants really came from a very wide range of backgrounds and a wide range of countries. And from us, what was most exciting was also being able to hear the voices of children and youth, and we'll share that with you following this presentation. So some highlights from the conference. One was that we did achieve high-level political commitment around the importance of robust CRVS systems. The need for gender-sensitive CRVS system was recognized, the need to integrate the health sector and CRVS systems. Importantly, there was wide recognition of the value of legal identity for all, and also the catalytical role that digitization can play. However, as we saw in some of the snapshots that I showed you previously, progress does need to be accelerated if we are to achieve the goals of the CRVS decade. While recognizing that there has been excellent progress until now, we're not on track for a lot of these targets to actually meet them. And it may be that we need to extend this regional initiative beyond the end of the decade in 2024. As part of this conference, where there was also a ministerial declaration. This is the second ministerial declaration. There was one which was also associated with the earlier conference. And the main difference is in this declaration, which to a large extent reiterated the commitments in the previous declaration. But firstly, this is now aligned with the SDGs, which it wasn't previously since it predated the SDGs. Obviously, the impact of COVID-19 has been recognized, and as we all know, CRVS systems, as my colleagues have also described previously, CRVS systems play a very important part in the response to the pandemic, especially around mortality. And the need to be interoperable with identity management systems and the implementation of the United Nations Legal Identity Agenda was also recognized. And finally, there was a further emphasis on the need for inclusive CRVS systems and to address inequalities. So that part was also re-emphasized. So out of the conference, some action areas for the second half of the decade have emerged. One is to strengthen the role of the health sector and interoperability with CRVS systems. The second is to increase digitization. Similarly, we need to make sure that CRVS and identity management systems are interoperable, with the civil registration system really acting as a foundational system. There's a need to strengthen the legal and regulatory frameworks. Medical certification of causes of death was recognized as an area of particular concern that really needs to be strengthened. And as discussed earlier, inequality assessments are also an area which we want to focus efforts on, as well as the production of vital statistics from civil registration records. So to that end, ESCAP has identified a number of areas of support for the remaining half of the decade. Some of these are taken directly from the previous slide. So inequality assessments, production of vital statistics, looking at how the CRVS business processes can be improved how we can ensure that evidence is used in practice and policy. So not just producing, for example, vital statistics, but making sure that they're also used in policy. We're strengthening and expanding regional networks of civil registration professionals, developing information products for the implementation of the regional action framework, as well as supporting our regional steering group and our partnership groups on CRVS, and advocating further for CRVS improvements. Finally, to bring this back to the UN Legal Identity Agenda, what are the implications for implementation of this agenda? The conference really emphasized the fundamental role of civil registration for all vital events. So it's not just that you can't have an identity management system without having a foundational civil registration system. Similarly, these systems should be interoperable, and as digitization increases, this should be increasingly a priority and also increasingly feasible and possible. Again, the SDGs were brought in for the first time, so making sure that these links with the implementation of the SDGs both directly and also as a catalyst for achieving the SDGs. And similarly, how can we learn lessons from the ongoing pandemic and ensure that these systems are resilient for future shocks, which we know will be coming at some point in the future. So thank you very much for your attention. And I'll now ask Predrag if you could kindly show the video of the children and youth statement.
Yes, sure. Just a sec. And I hope you will all be able to hear it and see it.
Birth, marriage, and death certificates are human rights.
A birth certificate is important in different stages of our lives. It reflects our identity and our relationship with people around us, including our parents.
यो पहिलो दस्तावेज हो जसले हामीलाई नागरिकको रूपमा मान्यता दिन्छ.
पासल याम सन्धा उपेन सहतिके आवश्यक वे.
And we will need it for future employment and in realizing our dreams. We will need it to secure important papers such as our national identification card, driver's license, and even marriage certificate when we decide to have our own family, and we need it to access health care.
Our birth certificate allows us the rights of our group to exercise freedom of movement.
And in the future, it will allow us to access financial service such as banking and insurance.
Data pencatatan kelahiran, perkawinan, dan kematian adalah penting, sehingga pemerintah dapat memastikan setiap warga negara, termasuk kami anak-anak dan remaja, mendapatkan hak-hak lainnya, termasuk pendidikan, kesehatan, dan pencegahan penyakit.
Marriage certificates give our parents to have an access to social benefits and services.
It also guarantees us with parental support in cases of separation or divorce, and with claim to properties or inheritance due to death of a parent.
මරණ සහතිකයක් තිබීම තුළින් මියගිය දෙමාපියන්ගේ විශ්‍රාම වැටුප්, රක්ෂණ මුදල් සහ අනිකුත් වන්දි මුදල් ලබා ගැනීමට හැකියාව ලැබේ.
Birth, marriage, and death registration do not only secure us access to our rights, they also give us protection.
Efficient birth and marriage certification will protect us from the irreversible impacts of child or early marriage.
सबै बालबालिका र युवाहरूले आफ्नो बालिका र आफ्नो युवा अवस्थाको आनन्द लिन पाउनुपर्छ.
The marriage certificate is an important document for women who experience harassment and violence at home and want to file for divorce.
Pendaftaran nikah bisa juga melindungi kami, anak-anak dan remaja, dari pernikahan yang dipaksa atau palsu.
Birth, marriage, and death registration helps the government in ensuring efficient allegations of goods and services.
මරණ ලියාපදිංචි කිරීමේ ක්‍රියාවලිය විධිමත් කිරීම තුළින් ලියාපදිංචි ඡන්දදායකයන් හඳුනා ගැනීම පහසු කරයි. එමගින් මැතිවරණ ක්‍රියාවලිය දූෂණයෙන් තොරව ක්‍රියාත්මක කිරීමට උපකාරී වේ.
Efficient death registration will allow government to know the cause of preventable deaths
and provide protective measures against it.
In case of violent death, violation of human rights, death certificate is very much important for any kind of documents and take any kind of necessary legal action.
But many people hesitate to register births, marriages, and deaths. They find the registration process complicated. It consumes their time, energy, and money.
Many people also hesitate to register birth, marriages, and deaths because of the equality of service in the legislation center.
Some experience discrimination. Some experience difficulty to correct errors made by data encoder themselves.
Some get discouraged when concerned government units and private institutions provide little help.
And add another obstacle to the registration process.
We, the children and youth of Asia and the Pacific, have the limitless potential to contribute to society.
Tapi potensi tersebut hanya bisa berkembang ketika hak kami dijamin dan dilindungi.
And this starts with our basic identifying documents.
As we participated in consultation and online forums on civil registration and death statistics, we saw that there is a need of awareness on registration for birth, marriage, and death certificates.
Children and youth need all adults to understand this. All adults and parents and other caregivers need to understand
how birth registration affects access to our education,
healthcare, and other government services.
We don't only want to share with other children and youth the importance of getting registered.
We want to have a dialogue with our governments.
We have recommendations to make registration systems responsive to the needs of its citizens, regardless of race, class, gender, ethnicity, religion, and abilities.
We, the participants of the Children and Youth Regional Forum on issues of civil registration and vital statistics held in May 2021,
strongly recommend for governments to make and enforce laws that support timely registrations of all births, marriages, and deaths.
Government also needs to ensure that the registration systems are efficient and accurate. We recommend
meningkatkan jumlah personel dan pusat-pusat registrasi dokumen penting yang dapat diakses oleh semua orang.
Providing appropriate training for all of its personnel.
Revival community and religion later in the legislation system.
රජයේ පවතින විවිධ ආයතන සහ දෙපාර්තමේන්තු තුළ සහ සම්බන්ධතාවය ඇති කිරීම තුළින් උත්පන්න සහතිකයට අදාළ තොරතුරු ලබා ගැනීමේ ක්‍රියාවලිය ශක්තිමත් කරයි.
Providing different accessible options such as online registration for parents and families of children and youth in different conditions.
Guaranteeing all parents and families of children and youth with assistance based on their different situations.
Governments need to make the birth, marriage, and death certificate registration simple and cost-free for our families.
And governments need to make sure information about this process is widely distributed in different languages and in forms of communication that are accessible to people who are differently able.
We also ask the governments to recognize probable age certificates for children and youth who are often sterilized or victims of abuse.
රජයේ නිලධාරීන් තුළ අනුමාන වයස් සහතිකය පිළිබඳ වූ අවබෝධය වැඩි දියුණු කිරීම.
संस्थाहरूबाट पहिचान नभइदिँदा हुने अन्यायबाट उनीहरूलाई जोगाउनुहोस्.
We, the children and youth,
need government,
civil society,
and other concerned individuals and organizations
to commit to the development of our full potential. This all starts with an efficient
and accurate registration system
where everyone is registered.
Register us to include us
in public services and programs.
Register all of us now.
हामी सबैको अहिले नै दर्ता गर्नुहोस्.
Daftarkan dan libatkan kami sekarang.
Register all of us.
Register all of us now.
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 Register all of us now.
Thank you very much. Indeed, a very informative video that we have seen here, and definitely the message is so straightforward and unambiguous as it can be. Let us now move through the multi-sectoral collaboration in the Philippines to improve birth registration among indigenous Sama Bajau community, to be delivered by Mr. Melvin Suarez, State Council, Department of Justice, Philippines. Please be mindful of the time, Mr. Suarez. You will have up to 10 minutes for the presentation, so please be so kind to focus on the major points that you would like to emphasize. Please go ahead.
Thank you, Sir John. I'd like to share my PowerPoint presentation. Can you see it now?
Not yet. Oh, no, it's loading. Yes, we can see it now. Please go ahead.
Okay. Good evening, good morning, good afternoon, everyone. I would like to express my gratitude for the opportunity to share the Philippines experience in pursuing a collaborative approach to birth registration, particularly the multi-sectoral collaboration to improve birth registration among the Sama Bajau population in the Philippines. I would like to underscore also how important is birth registration, being a more or less permanent and official recording of a child's legal existence and identity. While a birth registration does not confer nationality, birth registration, which led to the issuance of birth certificate, provides a proof of legal identity, including citizenship. In the Philippines, we adopted a whole of society approach to CRVS, including birth registration. There is a collaborative effort and steadfast commitment from the national local government, the private sector, the citizenry themselves, and developmental partners to improve birth registration. Thus, the President issued Proclamation number 1106, declaring 2015 to 2024 as the civil registration and vital statistics decade. We would like to highlight that this is in line also with the pledge of the Philippines during the high-level segment on statelessness to improve access of vulnerable and marginalized populations to documentation through birth and civil registration. This is also aligned towards achieving SDG 16.9 and the 2030 agenda to leave no one behind by open quote, getting everyone and the picture, close quote. We would like to point out that at the national level, there are two primary national interagency mechanisms to birth registration. We have the Interagency Committee on CRVS, IAC-CRVS, and the National Action Plan Technical Working Group for Action Point 5, our National Action Plan to end statelessness by 2024. Action Point 5 advocates for addressing statelessness through birth registration in the IAC-CRVS. The IAC-CRVS seeks technical guidance from the NAP-TWG on integrating statelessness matters in relation to CRVS. We would like to emphasize that the IAC-CRVS and the NAP-TWG work with our local civil registers who, under our laws, have the primary mandate to register births. Our local civil registers coordinate with our National Statistics Authority to preserve and record birth certificates. I would like also to share that as one of our best practices in the Philippines, our local civil registrars have waived fees for birth registration and penalties for late registration of birth, including fees for the correction of errors and the entries of birth certificates of our persons of concern, particularly our Sama Badjaus and our persons of Indonesian descent, two populations we identified to be at risk of statelessness in the country, in our country. I would like also to share that we have a mobile registration by our Barangay Civil Registration System. This is a house-to-house free birth registration in geographically isolated and disadvantaged areas. It includes advocacy campaigns on the advantages of civil and birth registration. Mobile birth registration, by the way, is also vital during emergencies and natural calamities. For example, the Typhoon Haiyan or Yolanda in the Philippines, in the reconstruction of lost or damaged civil identity documents or records. So, who are these Sama Badjaus? The Sama Badjao population in the Philippines are the seafaring indigenous peoples who are mostly found in southern Philippines or in Mindanao and some parts of Southeast Asia. This population is one of the populations we identified to be at risk of statelessness. Why? Because of their itinerant lifestyle and frequent border crossing and the generations of non-birth registration among this population. The common reasons that we identify for non-registration of birth among the Sama Badjaus are the following. We have the awareness on the legal importance of birth registration. They lack the confidence to access government services through impeding basic transactions, such as the processing of their birth records. And they have these logistical and financial challenges in the processing of their birth registration. In 2019, we launched a pilot delayed birth registration among the Sama Badjao's population in a selected area in Zamboanga City. This is one of the largest cities in southern Philippines. The initiative was led by the Department of Justice as the lead agency in the implementation of our National Action Plan to End Statelessness. And we coordinated with the National Commission on Indigenous Peoples, the local government unit of Zamboanga City, UNHCR, UNICEF, and the Sama Badjao community. By the end of 2021, we were able to issue a total of 1,155 birth certificates to the Sama Badjaos who participated in this pilot project. We also identified some challenges along the process. The delayed birth registration process takes time, as this includes a verification process where the Sama Badjaos are required to personally appear for interview with the staff from our City Civil Registrar's Office. There is a challenge on the lack of or no documents at all or evidence to establish the veracity of their identity or their parental linkage. There is this challenge on the cultural belief of the Sama Badjaos, particularly with their names, which they tend to change according to the health condition of an individual. And of course, the delays caused by the COVID-19 pandemic. However, we also have strengths and opportunities as we go along with this project. We have we built up a partnership at the national, regional, local government at the community levels. We were able to establish a good working relationship with each other, including our collaboration with UNHCR and UNICEF. We established a strong commitment among the stakeholders involved, and the participation of the Sama Badjao community themselves is ensured all throughout the process of the implementation. And for my last slide on ways forward, we continue to collaborate with identified partners and stakeholders to ensure the birth registration of the Sama Bajau population. We continue the leadership and the implementation of the National Action Plan to end statelessness by 2024. We pursue a parallel advocacy activities to ensure sustainability of this initiative. We have legislative measures to strengthen birth registration and our laws and regulations to reduce statelessness and resolve those at risk of such status. And we expand birth registration of the Sama Bajaus in other communities in southern Philippines. And I would just like to highlight as a final word that recently the Philippines in January 25th of this year have acceded to the 1961 Convention on the Reduction of Statelessness. I think the Philippines is the first in the Southeast Asian region to accede to the said convention. And the second milestone that I would like to share is last February 15, our Supreme Court have approved a rule on facilitated naturalization of refugees and stateless persons. This is the rule. The rule is the only, I think, it appears to be the only judiciary-led initiative of its kind at the global level that facilitates the naturalization of refugees and stateless persons. Thank you so much for listening.
Thank you very much, Melvin. Thank you for this presentation from the Philippines. And then we are taking full note of all the efforts that are being put in order to ensure that the eradication of statelessness in as short term as possible. We are now turning our attention to Georgia on ensuring resilient CRVS systems and producing vital statistics during times of crisis. The presentation will be delivered by Ms. Shorena Tsiklauri, who is the head of Department of Population Censuses and Demographic Statistics. Shorena, please be mindful of the time and try to stay within the 10 minutes allotment. Thank you very much. Please go ahead, take the floor. We cannot hear you, unfortunately.
Can you hear me?
Now, yes, please go ahead.
Oh, I'm very sorry. And please confirm that you can see my screen as well.
Yes, yes, we can see your screen. Mm-hmm.
Very good. Hello, everyone. Dear Chairman, first of all, please let me express my support for the Ukrainian people. It is very difficult time, not only for Ukraine, but also for most countries of the world. Dear friends and colleagues from Ukraine, my positive thoughts are with you. Slava Ukraini. Now I will start my presentation. As you know, my name is Shorena. I'm head of Population Census and Demographic Statistics Department in Geostat. On behalf of the National Statistics Office of Georgia, I'm honored to thank ESCAP, IOM, UNSC, and other co-organizing partners for scheduling this very important event and opportunities to share our Georgia's experience. As you know, the production and publication of vital statistics are largely depend on completeness of civil registration. This slide shows the registration system of births and deaths in Georgia starting from 2017. Georgia has highly developed online registration system. It should be noted that in my country, since 2011, the medical certificates are filling electronically and automatically sent to the Public Service Development Agency. If if births and deaths occurred in the medical institutions, the medical doctors are filling the medical certificates and sending it to the Public Service Development Agency within 5 working days. If births or deaths occurred outside of medical institutions, the representatives of the local administration make a statement of death or birth based on the information for family members. For example, and they are sending this notification automatically to the agency within 5 working days. Any non-receiving or late notification to the Public Service Development Agency and envisage the penalty. In Georgia, it should be noted that it is very important that birth or death registration is free of charge. Now, if we are going to focus on progress in taking the implementation steps contained in the regional action framework, we are pleased to note that the 3 goals of the Ministerial Declaration are mainly achieved in our country. And we are working hard to improve the quality issues, especially for causes of death statistics. This means that highlighting positive examples is important to ensure all targets are reached by end of the 2024. Therefore, one of the Geostat's priorities is to produce demographic statistics in line with international standards and requirements. I'm pleased to emphasize that my country represents such an example, having improved in the past few years its registration system. In Georgia, a series of reforms made between 2003 and 2017 reshaped the CRVS system as a whole to make it more efficient. These changes mostly consisted of removing registration barriers, which was very important, and facilitating the transfer of information between agencies. I mean, especially the Public Service Agency, who is charged of registration of civil acts, and CDC, who is responsibility for filling medical certificates and for checking the quality of causes of death, and as Geostat. As for CAPS-WIT initiative to ensure better data quality, such as the use of personal identification numbers to avoid the duplicates and the verification of ICD codes with the Anaconda software recommended by WHO. As you can see, for us, not only quantity but also quality matters. As a result of this progress, the first vital statistics report was published in Georgia in 2017. Thank you very much for colleagues from SCAP. In addition, the publication of vital statistics report is included in our statistical working program approved by Georgian government. And it is disseminated on our webpage once a year in English and in Georgian. The current pandemic is disrupting CRVS system all over the world, but well-functioning systems are more essential than ever. It is worth mentioning that despite the registration of vital events is being disrupted by lockdowns and social distancing measures, Geostat is publishing all data on time without any delay. The COVID-19 did not have much impact of the registration of vital events as far as the majority of registrations, including births and deaths, were available online over years. We move forward in the implementation of regional action framework for CRVS in Asia as the specific, and we assure you to our continued support in realizing this common goal. Thank you so much.
Thank you very much, Lorena, and the congratulations to the improvements that were made in Georgia over the past 4 years. We are looking forward to showcase these positive examples as a way forward for more and more countries in terms of the implementation of the UN Legal Identity Agenda and ensuring interoperability and the production of reliable vital statistics. So thank you for this example. I believe it is really indicative of the of the results that can be achieved, provided there is a firm commitment on all the partners. We are now moving our attention to the International Organization for Migration and its institutional strategy on legal identity that has been in the works for the past, if I understand quite well, over a year now, and it is ready to be introduced and promoted. I am giving the floor to Mr. Damien Thuriot, head of the Immigration Border Management Division, IOM headquarters. Damien, please, you have the floor.
Great, thank you very much. I'll be doing some general introductions, and I'll hand over to my colleague Zoran, who'll do an in-depth but rapid presentation. And I think it's important to stress it's not a formal launch. It's an information session because the formal launch will be done in a couple of weeks. I mean, let me start by saying how happy we are to be actually presenting here, and happy to see also some colleagues from the member of the UN Legal Identity Agenda Task Force. And we all know this, right? You know, if you don't have legal identity, you don't exist in front of the law. And out of the 1.1 billion people who don't have proof of legal identity, we of course have migrants, we have IDPs, refugees, and returnees. And they face significant barriers when they try to access rights and try to access services that are linked to their legal identity. For instance, identity documents can be lost, they can be confiscated, or they can even be destroyed, for example, during displacement. And without that proof of legal identity, migrants, including the women, the children, the vulnerable people that are affected, they face increased challenge in exercising their basic human rights, importantly, in participating in society, and of course, seeking protection of the law. Increasingly, what we're saying, and today I'm here in Montevideo, we're working with the government on a legal identity, on legal identity documents, the challenges of birth registration. Parents who cannot register their children, migrants without proof of legal identity, are thus in continual risk of poverty, of statelessness, exploitation, and birth registration for those migrants specifically in countries outside of their own is a particular challenge. Now, given this context, and the fact that legal identity is included in the 2030 Agenda, is included in the Global Compact for Safe, Orderly, and Regular Migration, from an IOM perspective, we have a momentous opportunity to assess the essential role of legal identity in migration and in human mobility. And of course, I think like most of you, we see that this convergence of the SDG targets 16.9, 10.7, that provides a strong framework for us to achieve other migration-specific development outcomes. And so we see legal identity as an accelerator, a catalyst for many of the other SDGs. Now, because legal identity is relevant to a broad range of IOM programmatic areas, our Director General asked us to come up with a very specific legal identity institutional strategy, of which you'll get an insight in a couple of minutes. And that's meant to serve as a blueprint to strengthen our engagement on legal identity, on migration management, on mobility, on security and development. And while, of course, we've been looking at the opportunity that this represents, I mean, just think of, functional identity credentials, such as travel documents, which are essential for migrants. Or more recently, how without legal identity, migrants could not access health services, right? So clearly a great opportunity. But on the other hand, we've also been focusing on the challenges. And we want to ensure that the IOM strategy that we're putting forward fully considers the risk and the negative impact that may be linked to legal identity systems. For instance, the need to ensure that we have strong implementation safeguards that are grounded on equality, non-discrimination, or the protection of personal data, or the right of each and every migrant to privacy and consent to how their data is processed. So that is how our legal identity strategy is structured. Let me conclude here in terms of setting the scene. To sum up, I think we clearly are at a crucial moment for us with an increased global focus on legal identity as an enabler of global mobility, equality, and sustainable development, and in the long run for the well-being and the protection of the migrants. It is thus pertinent that we make use of this opportunity, and IOM will be looking to harness this strategy to improve access to legal identity and identity systems without leaving any migrants behind. Let me maybe now hand over to Zoran, who will be present on this, for having an overview of the forthcoming IOM institutional strategy on legal identity. Thank you very much for your attention.
Thank you very much. Thank you very much, Damien. And now let's move to Zoran. Zoran, please go ahead. You have the floor.
Thank you very much. I'm starting my presentation. Please kindly confirm if you can see the slides.
Yes, we can see the slides. Please go ahead.
Excellent. Thank you very much. I'm really privileged for this excellent opportunity to address this distinguished audience and provide an informative insight into IOM's institutional strategy on legal identity. As a legal identity civil registration expert, I was privileged to be invited by IOM to support institutional IOM task force on legal identity to facilitate the discussions in the process of drafting of this institutional strategy, which took place in the course of almost 1 year of internal exchange between various departments, units, and also consultations with the IOM missions in the field and IOM member states in order to come up with the IOM's institutional strategy on legal identity. I would like to start with a brief introduction in terms of what prompted originally IOM to venture into developing of its own institutional strategy of legal identity. And as it happened with the adoption of Sustainable Development Goals, the recognition of legal identity in the context of migration became more prominent. And it was at that point with the adoption of Sustainable Development Goals, with the target 16.9 in particular, the global legal identity gap was fully revealed and the commitment was made to achieve legal identity for all by 2030. At the same time, within the target 10.7, SDG calls to facilitate orderly, safe, regular, and responsible migration and mobility of people, including through the implementation of planned and well-managed migration policies. For migration experts, even at that stage, the fact that 1 billion approximately estimated population across the globe does not have legal identity was a clear sign that something needs to be done in that area if migration across the globe on the global level is going to be conducted in safe and orderly and regular fashion. In parallel with the adoption of Sustainable Development Goals, Global Migration Compact was adopted with a clear set of objectives that member states have agreed to achieve in order to ensure, again, orderly, safe, regular migration and protection of rights of migrants. And within the objective 4, legal identity has been specifically mentioned as an objective, and the member states have been called to implement a range of measures to facilitate migrants' access to legal identity and the proofs of legal identity, in particular in the context of access to civil registration. Now, as IOM internally debated what are the implications of legal identity in the context of a migration continuum, as a person decides to leave their own state, go to another state, stay there as a migrant for a while, and then come back. It was becoming very clear very soon that legal identity plays an important role across the entire migration continuum. So the lack of registered legal identity, inability of a migrant to present a proof of legal identity is a major impediment to enter another state. We all know that without a passport, it is not possible to cross the border in a regular fashion and be admitted in another state. And that means that anybody who wants to travel abroad will face obstacle in satisfying immigration-related procedures of the destination states. And in that sense, there has been an emerging recognition that legal identity affects global mobility in general. And if we translate the situation of estimated 1 billion population across the globe not having access to proof of legal identity, that means that about 1 billion population do not have access to orderly cross-border travel, and many of them are forced to travel as a consequence across the borders in irregular fashion. And if they want to travel abroad and stay abroad at the destination state and seek opportunities in another state, they will need to obtain a permit to stay and often an entry visa in order to be granted an extended stay at the destination state. In such instances, the destination state would insist that a range of documents and proofs are being provided, one of the most important ones being proof of legal identity of that particular individual. If a person is found on a territory of a foreign state and then don't have sufficiently acceptable proof of legal identity, then that person will have difficulties to access resident status once that person is abroad, and obviously will have limited access to employment. And ultimately, a lack of proof of legal identity has a particular effect on migrants in the context of their ability to exercise their right to leave and return to their country, their integration into mainstream society, and ultimately ability of it will affect the ability of the authorities to effectively protect their rights. When looking into the category of population affected in the context of a migratory continuum, IOM concluded that there are 4 different categories of migrants affected in a different way with the view of legal identity. So we can speak as a first category of people who are, let's say, would-be migrant. Anybody who is on the territory of their own state that at any point in their lives might want to travel abroad. These are the nationals of their own state who need registered legal identity to access regular migration or to travel abroad even as a tourist. But then we have the category of migrants who are already reached the territory of a foreign state. And then as they reside on the territory of the state that they are not citizen of, then they require access to civil registration in the country where they reside, but not only there, also in the country of the origin. So they face the issue where they have to reflect their vital events and register their vital events in 2 different administrative settings, at the destination state and also in their country of origin. Then we have another category of migrant population. These are vulnerable mobile population, including displaced persons, victim of trafficking. These are people who in one way or another reach a foreign country, but then lost documents or access to these documents and are not being able to prove their legal identity and therefore require a particular assistance in order to reconstruct their documentary evidence of legal identity. And finally, there is a particular group of irregular migrants who didn't arrive in a destination state in a regular fashion, might have some proof of legal identity or might not have a proof of legal identity, but nevertheless, as they reside on the territory of the destination state, they need to register their vital events as the characteristics of their legal identity change, such as they get married or they want a divorce or they have a child that they want to register. However, their access to legal identity and proof of legal identity is determined by their relationship with the state. In many instances where the states, host states, are acting in good faith, enabling access to irregular migrants will dramatically increase their access to services and rights. However, under certain circumstances, government may abuse the registration system to use it as a pretext for deportation and expulsion of migrants. So therefore, in the context of IOM, it was very important to discuss when it comes to the strategy, how to approach this particular category of population. Now, this has all resulted in a 4 pillars on which IOM will base its future action when it comes to IOM's work on legal identity. The first pillar is to support development of consular services to issue civil registration, citizenship certificates, IDs and travel documents for migrants. with the idea that migrants are provided ultimately with access to civil registration and identity or travel documents issuance services in their host country, as well as the documentary proof of their nationality from the country of origin. In that sense, IOM commits to work in the following intervention domains, and by strengthening civil registration services in the country to issue proof of nationality and travel documents at consular representations abroad. IOM will strive to promote bilateral or regional policies that are rights-based, so exchange on a multilateral basis within the regulated environment of specific registration data, including measures for updating vital events of relevance to the migrants in both host country and country of origin. And finally, IOM will enhance consular services to support nationals abroad without documentary proof of legal identity. Moving on to pillar number 2, that pillar deals specifically with assisting migrants without legal identity documents, with the idea to achieve the outcome where vulnerability of migrants without legal identity documents is addressed through appropriate assistance services, whether to support the states or provide the assistance directly. So in practice, what IOM pledges to do with this strategy is to assist migrants directly to obtain paper-based or digital evidence of legal identity, and explore possibility and, as appropriate, supporting irregular migrants or migrants caught in crisis situation with recording their vital events when unable to access service directly. Now, the pillar number 3 concerns the supporting national civil registration and identity management systems to facilitate regular migration and mobility. The idea is that the pillar 3 would underpin what IOM wants to achieve with pillar 1 and 2, which means building a national legal identity system, ecosystem, so that it has sufficient capacity to extend its services through the consular services abroad, so that pillar 1 and 2 can be fully fulfilled. So the idea, the outcome that IOM desires with the implementation of this pillar is that nationals can prove legal identity to exercise their right to leave their country, apply for admission and stay in a third country, and or to return to their country in an orderly and safe manner, while benefiting from their rights throughout the migratory process. In terms of areas of intervention, IOM will work to strengthen national civil registration and identity management systems, will support strengthening of national identity card and travel documents issuance processes, and will support identity management systems and civil registration of migrants in particular. And finally, as the debates on the development of the strategies revealed that the access to legal identity and ensuring proof of legal documentary proof of legal identity in migratory context is extremely complex area, IOM pledges to provide thought leadership on the nexus between migration, displacement, and legal identity, including their impact on the protection of migrants. The expected outcome of the work of IOM in this area is that IOM contributes to the development of global policies and strengthening of existing policies aimed at providing efficient assistance to migrants to register and, as appropriate, update characteristics of their legal identity. In concrete terms, to work specifically on this pillar 4, IOM will provide a global platform for research and sharing of good practices on how to improve national legal identity systems in accordance with the international law, including human rights law. IOM will promote cross-border bilateral and multicultural cooperation to enable sharing of information on registered vital events in civil registers of their nationals residing abroad, including possibilities for cross-border verification of legal identity directly in national legal identity systems. Finally, IOM will further facilitate dialogue and promote good practices and policies to facilitate access to legal identity for irregular and forcibly displaced migrants whose legal identity cannot be determined. So these are the 4 pillars on which IOM's institutional strategy on legal identity is based, but the strategy also looked into how this, providing general indication as to how can this be implemented in practice. So in order to implement these pillars, IOM will leverage existing institutional and technical capacities, because during the discussion it emerged quite clearly that IOM has been already providing a great deal of support in the area of legal identity, but there is now need to put it in a more systemic manner. And as needed, IOM will expand its capacities in that area. Secondly, IOM will pursue and strengthen a whole of UN approach in delivering a holistic and concerted support to strengthen inclusive national legal identity systems that conform with international laws and standards, and that contribute to reducing statelessness. Finally, IOM will seek and strengthen partnership with global and regional development financial institutions, private sector, civil society, and local community partners. As Damian was saying earlier, intervention of IOM in legal identity area is not carte blanche. It's not going to be delivered upon request, any kind of request. Interventions of IOM are going to be based on specific principles directly related to well-being of migrants. And these principles are equality and non-discrimination. Any intervention of IOM will need to be people-centered. IOM will be using right-based approach. It will be based on do no harm principle for migrants, and it will have specific consideration and strong consideration for the protection of privacy and personal data. In order to make sure that these principles are fully taken into consideration, IOM legal identity strategy highlights implementation safeguards that needs to be in place. So any programming, any support provided needs to be subject of prior inclusive consultations with affected stakeholders to inform preliminary assessment. It needs to ensure that developed legal identity systems are necessary and proportionate means to achieve legitimate objectives, that legal frameworks is in place regulating access to and protection of personal information, and finally that there is a mechanism for redress and that they are in place for cases of incorrect identification or violation of privacy. With this, I conclude this presentation of the IOM legal identity strategy. And if we have any time left, of course, we would be happy to respond should there be any questions. Thank you very much.
Thank you, Zoran. Unfortunately, our time is up, but thank you very much for the presentation that is quite comprehensive and detailed in terms of what IOM intends to do in the future. And with this, dear colleagues, I would like to express our appreciation for this side event. We went through different segments of the UN legal identity agenda umbrella to showcase that this is a concept and a model that is really applicable throughout the world and is based on the existing and potentially the developed components of the government systems that need to be put in place in order to ensure the universal exercise of human rights and the production of vital statistics and the identity legal identity for all from birth to death. We wanted with this kind of walk throughout different components, throughout different regions of the world, to showcase that this is something that is gaining momentum, and to urge everyone to essentially be part of this implementation process. With this, I would like to express our appreciation to all of you for participating at this side event. Should you have any questions or comments, please do not hesitate sending them to us. I would also like to express my special appreciation to Predrag, our colleague, Predrag Savic, who took the heavy load of organizing this event, supported by Andrew Smith. So thank to you both. And hopefully we will, on Monday, when the UN Legal Identity Agenda is on the discussion, at the Statistical Commission, we will have another input that will then guide us in further steps towards the universal registration of all vital events, and finally reaching to the point where we do know how many babies are born and how many people die on a regular basis. Thank you very much, and have the best rest of the day or night, as the case may be. Thank you and goodbye.